Hello. Okay. So let us continue with Nash therapeutics study streak. And so far, we are discussing some female remedies which Dr. Nash has mentioned in relation to each other. We did a bit of the good polycrest remedies. Good to see some people on YouTube and Instagram. Dr. Priyanka, Archana Vijay Lakshmi, Vaibhavi Homeopathic Clinic, and JP Homeopathic Miracle. So, anyways, if you are new to this study streak, it is something about rediscovering our old and forgotten authors in the midst of all the new methods that we are continuing. Good evening, Dr. Priyanka. Good to see you. You are attending all the sessions, and I hope it gives you some inspiration from Dr. Nash because he is a very important and landmark homeopath, which whose book every homeopath should have on his desk. So today we'll pick up around 6 remedies from Nash Therapeutics, and the reason of taking up 6 remedies is that few remedies are, you know, very small. Like in a page, he has given 3 remedies, and the other 3 remedies are 1 page each. So the remedies are not vast enough, they are quite small. And what Dr. Nash does is that he mentions some keynotes of the remedy which he has clinically seen and cuts out all the rubbish. At times, it's not needed because clinically, what is relevant is important. And then Dr. Nash gives a case from his own practice if he has seen for that remedy or if he feels the need to mention that case. So today's learning, we'll take up 6 remedies: Actia resmosa, Sabina, Helonias, Erigeron, Trillium pendulum, and Millefolium. So the first remedy, Actia spicata or Actia resmosa, rather the other Actia. The Actia spicata will come some days later because it's more of a rheumatic remedy, and Actia resmosa is more of a remedy which Dr. Nash says in the first line itself. Another remedy which exerts a strong influence on the female organism. It is a nervous remedy. We need to know there are 3 components rather: female aspect, the mental aspect, and the nervous aspect. Once we understand these 3 aspects, our job to prescribe Actia resmosa becomes much easier. So the remedy, the person, both of them, you see that they are hysterical in nature. Those who are hysterical in nature and having nervous symptoms or mental symptoms or female symptoms, you will see that actia resmosa should be the first remedy that should strike our mind, even if we don't do the repertorization and just go through the symptoms mentioned by the patient. The prime symptoms, what Dr. Nash clinically says, are seen in this remedy are twitchings, spasms, convulsions, neuralgias, mental symptoms. So, apart from these neuralgic symptoms, which are of prime importance, Dr. Nash tells us that the patient of actia resmosa will be shivering or will have nervous chills with coldness. So, a lot of times we get such patients who feel that, I am not so good and I have these internal tremblings which go on for some time. They are nothing but they are expressing symptoms of their internal nervousness, and actia resmosa is the first remedy that should strike you right at that moment to help you understand that what Dr. Nash gives is clinically seen in all such patients, and you will be able to catch this very easily. The patient would also have fainting spells or fainting fits, which we also see in Ignatia. Next, Dr. Nash tells us that this person would probably talk incessantly, and you will at times feel, and this is what has happened with me, this is my experience. I've always felt that such ladies should be given lacases, should be given sulfur. They are theorizing, they are talking. But one of the prime remedies which we see in uh, loquacity and talking incessantly and also changing subjects is actia resmosa or semicifluga. And what comes next is something beautiful, and this will probably be seen by all homeopaths in their clinics. The patient is narrating some symptom, and it is not actual narration, but it is actually a form of you know going to the thought which was not good in their life, or some bad incident had happened, and the patient is again and again narrating that thought. So how Dr. Nash mentions is really beautiful. Grieves, and there is troubled sign. So the patient grieves. Now, no patient would come and tell you that I was grieving for so long, or I am grieving because of a loss. They would probably go to the sad moment of their life and again repeat that, or maybe think pensively about that moment and give lot of emotional aura towards that bad situation in their life. That is grieving over the bad incident or grieving over certain thought which you will see clinically. So they will be talking incessantly, and they would be talking incessantly about the bad incident or bad event that has happened with them. And the patient would be gloomy with sleeplessness. So, although all these things are mentioned in 3 or 4 lines by Dr. Nash, what is interesting is that you will see these 3 4 things in 3 4 different areas: physical generals, sleep disturbed, patient is sad in expressing her symptoms, patient is loquacious while narrating her complaints, and patient is, once or twice she has spoken of a bad moment in her life. That would be the overall picture of actia resmosa. And finally, the patient would tell you that I don't know if I am in the right mood or right mind frame of mind while narrating all this, thinks she is going insane. So all these components, the loquacity, the troubled sign, or the patient will draw long breaths while they are talking, that would be enough for you to prescribe actia resmosa. And she would probably express all these things in a sad mood. No patient is going to tell you that I am grieving and I am gloomy. It is your interpretation that will decide. So if you can understand the expressions of the patient, that would be much better than interpreting the other things what we are all doing with the new methods that have come up. Next is Actia resmosa. Dr. Nash tells us that head and the neck is involved, from the occiput to the neck, and the nerves along the neck towards the hand. For ciliary neuralgia, this is one of the top remedies. And then he goes on to explain that how this remedy is of importance in ciliary neuralgia, and also in females this will be a prime complaint, and the pains will be from side to side, from left side to right side in the pelvic region. The menstrual function will be irregular. Patient would tell you that my periods are never in order. If the periods are in order, the only remedy that should strike your mind first should be Lachesis. Allen's keynotes, go to Allen's keynotes, open Lachesis remedy, you will see menses regular, the only remedy in the entire materia medica. And Actia resmosa will tell you that sometimes the periods are excess, sometimes they are very less, sometimes they are mix of excess and less, some days excess, some days less. And there are these neuralgic pains, or there are these symptoms that you see of mental disturbances or loquacity or grieving or troubled sighing, which I described few minutes ago. So good to see some of our regulars joining uh, YouTube as well as Instagram. Dr. Rashida, Dr. Priyanka Kushwaha, Dr. Lekha, Dr. Lich, someone. So there is a request to follow Homeo Health Corner. Right, bang on. You catch the person bang on and tell that yes, you have to follow now, otherwise I'll not attend your live. Nice to know. Good marketing strategy, I would say. But content is more important than doing all sorts of such marketings. This is what I is my personal suggestions. Having an experience of 10 to 12 years of marketing in the homeopathic field, this is my honest suggestion. This is not the right place to come and bang on a speaker and tell that follow Homeo Health Corner. This is pretty nasty comment, I would say. Going further, we see that in Actia resmosa, Dr. Nash tells us that there are metrorrhagia, there is metrorrhagia and left mammary pains, which will always accompany, and there will be backache with spinal irritation, sympathetic with uterine troubles. And you will see that the patient would always narrate and tell you that my muscles are painful. And if you try to understand the location of the area, of the muscles, you will always see that the bulk of the muscle, the belly of the muscles are affected. That is Actia resmosa for you, my dear homeopaths. And this is how you would be able to prescribe Actia resmosa. In short and sweet, one page, Dr. Nash mentions this remedy. Next remedy is Sabina. Best remedy Dr. Nash describes for profuse flowing from the female organs, metrorrhagia, menorrhagia, abortions, or after labor. And now he gives 5 lines and around 4 or 5 remedies. And what are those remedies? Sabina, Kali nitricum, cyclamen, ferrum met, and colophyllum. How does he describe? For Sabina, he tells us that there is hemorrhage which occurs in paroxysms aggravated by motion. Mostly after abortion, he has given it, and pain is from one pubes to the other pubes in the pelvic bone. Kali nitricum and cyclamen, he tells that the blood is dark. Ferrum metallicum, he tells that the blood is partly clotted or partly fluid and watery. And for colophyllum, he tells that clots are black, just like we saw in cyclamen and Kali nitricum. And there is loss of tone in the uterus. There is irregular and spasmodic, irregular spasmodic action of the uterine contractions. Those who are on YouTube, they will be able to see a PowerPoint with my demonstration, and it's good to see a PowerPoint because these things need to be explained well in a good formulated manner, in a methodical manner, rather than just coming on screen and describing them. So on Instagram we can't share the screen, that's why we are just narrating it as it is. But on YouTube, those who wish to go Homeo Setu YouTube channel, you can go and subscribe, stay subscribed. There is something interesting learning coming up in 2025. You will get something really valuable content and helpful for your clinical homeopathic practice. For Sabina, Dr. Nash tells us that many times patient would look like pulsatilla in the terms of modalities: better by cold open air, aggravated by warm room. But the differentiation will be important. Pulsatilla, if you give to such patients, it will always increase the flow of blood in each periods. Stop the remedy pulsatilla and give Sabina, it will arrest or bring it in order. So that's where you will differentiate pulsatilla and Sabina, and this is the personal experience of Dr. Nash. This is very important because it comes from a person who has seen cases after cases and quoting. He has been quoting, hearing Lippe, Gunsi, Hahnemann Materia Medica, Allen's Encyclopedia, all the authentic books. So for Sabina, Dr. Nash tells us that Sabina is like Viburnum opulus in pain from back to the pubes and also cramps. And like Colophyllum, Sabina also has arthritic swelling of the wrist and the toe joints. So all the female remedies you will see is that they have kind of pains in the smaller joints. So all the cases where hysterectomy is done, and after that, if the patient is developing wrist joint pains or any rheumatic complaints, your target should be these remedies: Sabina, Colophyllum, etc., etc. So he concludes the remedy Sabina, and next remedy we go on to is Helonias. There is lot of weakness in a patient who presents to you because of lot of blood flow every month, and you are giving all sorts of tonics: alfalfa tonic, avena sativa, pulsatilla, and ferrum metallicum, ferrum phos, biochemic, left, right, center. Patient is not improving. This is where Helonias comes into picture. General debility condition of women with many uterine symptoms. Prolapses from atony or indolence or hard work or luxury. It can be polarities, extremes. It can be hard work or it can be luxury, indolence. And along with this, there is anemia. And in lot of cases, what Dr. Nash tells us is that he has seen albumin in in pregnancy cases. He has seen pregnant ladies having albumin in urine, and this remedy, Helonias, takes away the albumin from the urine and restores it to normalcy. How many times patients have presented you with the urine routine complaints, and how many times have you as a homeopath seen the urine routine and prescribed the remedy? If you or your colleagues have attended Allen's keynote study streak or my renal calculi management workshop, you will see that I had described that how on the basis of urine routine you can decide on remedies and prescribe it with much ease. Sadly, we are running after new methods, but a simple urine routine test with 100 rupees or 120 rupees for a patient would give you around 100 remedies, different remedies to prescribe, rather than going after simple ways of prescription. We are complicating things, and the more intriguing it is, the more we run after it. That is the problem of all homeopaths. Albumin in urine, Helonias will clear it for you, my friends. And diversion of mind ameliorate is a common symptom in all the Helonias cases. This is what Dr. Nash also tells. There is a typical phase in a female, which Dr. Nash describes as consciousness of womb in all the females during puberty, pregnancy, or during labor. This is where Helonias is indicated. Potency given by Dr. Nash is second to 30th, and just like Helonias has distinct consciousness of womb, Pyrogen has distinct consciousness of heart. He just mentions a very small line to compare this distinct consciousness terminology, and the rest is for us to decide when to give which remedy and based on what symptom. So Helonias was a remedy which was probably less proved, or Dr. Nash did not knew much, and he has given that this remedy needs proving, and we can compare it with Eletris farinosa. So that will come maybe later down the line after a few days of our Nash therapeutic study streak. As of now, we have completed three remedies: Actia resmosa, Sabina, and Helonias. The next three remedies, and Dr. Nash mentions these three remedies in one page itself: Erigeron, Trillium pendulum, and Millefolium. And he goes on to tell us that these are the three remedies which have the reputation for their power to control the hemorrhages. And those who are watching on YouTube, there is a tabular form of presentation of my session right now. The channel name is Homeo Setu, and I've given three columns: Erigeron, Trillium pendulum, and Millefolium. For Erigeron, Dr. Nash mentions, now he has given in paragraphs everywhere. But in all the sessions that I have undertaken so far, I have tried to compile the remedies in a tabular form so that we can differentiate very clearly one remedy from the other. And this is very important for homeopath, because when you are reading in a paragraph form, it is very difficult to understand the differences and do the comparisons. But when you are seeing the same comparisons and differentiations in tabular form, which is there on Homeosetu YouTube channel, you will understand it much better. So for Erigeron, Dr. Nash tells us that epistaxis is one of the key indications for this remedy. Congestion to the head, and there is red face, just like Melilotus. There is hematemesis and lot of retching and burning. For you to understand retching, it is something that an ineffectual vomiting, just like how patients who have diarrhea and tenesmus, retching is almost similar for the upper gastrointestinal tract. The patient wants to bring out, bring out, bring out, but he just can't reach out to the bottom of his stomach pit to bring out the stuff which he is intending to bring out. In Erigeron, there would be hematemesis, retching and burning. There is bleeding, burning hemorrhoids, and hemoptysis. So everything is in blood, 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 and there is hematuria or stone in the bladder. So all the cases, all the patients who report to you with a sonography report that there is a stone in the bladder, and in the urine routine report, we see that there is occult blood, Erigeron is the remedy to be thought of. Prescribe on urine routine reports is very easy and very, very, very simple with method, rather than complicating with new methods and new terminologies. So what Dr. Nash tells us, hematuria or occult blood in urine routine, what we see normally nowadays, and bladder stone from the sonography report, what we'll see, Erigeron can be thought of. Another remedy, which this is my suggestion, hydrangea can be thought, and Ocimum canum as well. Now let's go to the second remedy which Dr. Nash describes in the series of three remedies: Erigeron, Trillium, and Millefolium. Trillium is the remedy we'll take up. Trillium remedy, genuine hemorrhagic remedy. The blood would be oozing actively or passively. Remember, we did the remedy yesterday where there was passive blood flow, and you will have patients with passive and active bleeding. You will need to differentiate from the nature of the blood and the complaints. Trillium pendulum, Dr. Nash tells us that this remedy is resembling China officinalis in flooding with fainting and dim sight and noises in the ear. If there is lot of bleeding and then the weakness has come up, China is to be thought of. If the bleeding is going on with fainting spells in between, but the patient is able to recover well, trillium can be thought of. This small and subtle differentiation on the physical aspect is very important, and it's easy to understand. There is no complicated method which you need to learn. Just open Leaders in Homeopathic Therapeutics by Dr. Nash, and everything is mentioned right in front of you. Read between the lines, and it will be a very easy prescription for you when you see the same patient in the clinic. Trillium pendulum, Dr. Nash tells us that we can use it very well in climateric, provided all the other symptoms are there. Next remedy, what Dr. Nash tells us is millefolium produces hemorrhage in the pathogenesis, and Dr. Nash quotes Dr. Hahnemann from the Provings of Materia Medica. Millefolium causes nosebleed as well as hematuria, and the blood is bright red like aconite, but there is no fear. Now, what comes next is something which is a beautiful eye opener, and Dr. Nash gives his own case of epistaxis in the remedy millefolium. How many authors would go and give their own case, their own failures, and publish their failures to the world? Very rarely. Dr. Nash is one of them. In his entire book, he has given lot of failure cases and how he failed and how he prescribed. So, as a child, as a person who was growing up, Dr. Nash had lot of epistaxis, and Dr. T. L. Brown used to treat him, but it did not help for a long time. He went to his mother and grandmother once, and his grandmother told him to chew a yarrow root. This is widely available in the United States of America. He took the yarrow root and he ate it, and the epistaxis stopped. The yarrow root is nothing but millefolium. After a few years of getting cured with the, you know, raw substance or crude substance, so it would mean that Dr. Nash probably experienced a phase like Ayurvedic doctors do. They give the roots directly to chew. So after getting cured with millefolium, the raw substance, Dr. Nash, as a grown-up doctor, was going to some mountain for a hiking, and he saw an old man who had frequent epistaxis. And the old man told him that he had taken Sikkelkor but failed. Dr. Nash told him to take yarrow root, and that person got cured. So this is the beauty of, how Dr. Nash failed and cured himself, failed from some other homeopath, but got his result in a raw substance which was widely available in the United States. And that's what concludes our six remedies today: Actia resmosa, Sabina, Helonias, Erigeron, Trillium pendulum, and Millefolium. Those who have joined late can again go through the recording. It will be there for some time. But if you wish to clinically improve your homeopathic materia medica repertory, homeopathic practice, follow Homeosetu on WhatsApp, Instagram, YouTube, Facebook, all the social media channels. And there is something interesting coming up for all homeopaths to upgrade their practice. That's all.